Okay. So now we have to consider the vertical. Okay, so now we're not, now I'm not talking about bite wings anymore. Now we're going to move on to something called the periapical. The periapical. So the periapical, P-E-R-I, apical, A-P-I-C-A-L, periapical. The prefix of that, peri, means around. Apical is referring to the apex. So whenever you take a periapical film, you should be seeing the crown, the root, the apex, and the surrounding bone structure of at least 3 to 5 millimeters beyond that apex. So the area around the apex. So, and a doctor may ask you to take a periapical, or he may say, can you just take a PA of a particular tooth? And then you have to say, okay. And when you bring him back the film, he is expecting to see, whether it's a molar or a premolar, I'm expecting to see the crown, the root, the apex, and the surrounding bone structure. If we are missing the apex, guess what? We didn't get what we needed, and we have to retake that x-ray. Okay. Okay, so on a film, I'm going to use this as a film. This is going to represent our film, and I'm going to place that right there. And then I want to give you a couple of different things. So, so we are doing a periapical using the bisecting technique. Just to refresh your memory on the bisecting. What does bi stand for? Two. Sect, I said, was to what? Section, or to cut. So we're cutting two angles in half. What are those two angles? The two angles that we're cutting is the angle of the film and the angle of the tooth. Angle of this tooth is going straight up and down, right? Okay, so I'm going to give you a new name for this angle of the tooth. The angle of the tooth is from the crown to the root. From the crown to or through the root. It is that general angle of that particular tooth. That is called the long axis of the tooth. It is the imaginary line that is going from the crown through the apex of those teeth in a general way. On this tooth, you've got 3 apex. One's going this direction, so they're all coming in at different angles, but the general direction of it, and it is going like this. Okay. We okay so far? Okay. So if I have, and this is a 90-degree angle, isn't it? This is 90 degrees. This is going this way, this is going this way. This is a 90-degree angle. So I am coming in like this. So that is the angle of my tooth, long axis of the tooth, and this is the angle of that film. If we are to bisect both of those angles, it is an equal amount of those two angles. So if I'm going to split these two in half, I am coming in like this. That is my halfway mark. This halfway mark is called the bisector. This halfway mark is called the bisector. Angle of my long axis of the tooth, angle of my film. The halfway between there is the bisector. So I'm going to be asking you guys, every time we do a periapical, where is your bisector? How do you find your bisector? You know, so, you know, we're starting off like this, but eventually we'll move to the mouth. I'll make it a little bit easier. I'll start to transition that into what that looks like for the mouth, what that looks like for the dexter, and then you guys will start to kind of get this a little bit better. We okay so far? Okay. So if I'm just looking at these two, we already know this is laying flat. You could see the film, it is completely flat. You can see the tooth, it is going straight up and down. So the bisector between these two angles is right there. Are we okay so far? So, here's the idea. If you already know what the bisector is, and you figured out those two angles, and you know that that bisector is coming in like this, remember this was horizontal. This is horizontal. This is vertical, up and down, okay? And you're basically going to take that vertical angle and make sure that it is parallel to your bisector. As close as you could possibly get, you know. You really want to make a pretty good educated idea based off of these two angles. I think I know where my bisector's at, and the closer this PID is to that bisector, the more accurate your film or your tooth is going to be for that dentist. We okay? So let's test it out. I'm going to go ahead and turn these lights off. I don't know if this thing will fit through there. Nope. So we'll just use this as the PID. So we said that that is the bisector right there. And let's just say that this is the PID, mini-form, right? Mini-form PID. And we're going to put it at the flat portion of this parallel to the bisector. I'm going to bring it back here, and I'm going to take the x-ray. And if you take a look at that, you can see that the tooth is pretty much the same. If this was to fall, it would fall right there. If that tooth was to fall and lean this way, it would fall right there. So it is basically the same length as that tooth represented on that film. So we have the crown, we have the root, we have the apex, and we have the surrounding bone structure. Okay? We okay so far? If you get this wrong and you put more than the angle of the bisector, if your PID is positioned in the way to where it is more vertical than the angle of the bisector, what happens to your film? What happens to your tooth on your film?
You don't see the roots.
Well, the roots are there, but they may be very small. But what happened to the whole tooth overall? Yeah, it got compacted. It got shorter. Or we can say it is foreshortened. It is foreshortened. So this is the error that we have in your textbooks, and you'll want to know what this is. So any position of the PID that is more than the bisector will result in foreshortening. More than the bisector will be foreshortened. So what do you think if I now take this PID and I position it to where it is less than the bisector? What do you think is going to happen to this image? It'll be elongated. So if I take this and I bring it down, you can see that it now stretches and it goes off of the film. It is elongated. And actually that would even be upside down like this. And those apices that were on there are now off, you know. And what we're trying to make sure is that the apex is on. Does that make sense? Okay, any questions on that? We good? Okay. Okay. Okay, so let's take a periapical, and let's just say that we're going to do it on these anterior teeth, these 4 anterior teeth. So if we take the film and we place it inside the mouth, and we have it at an angle, you can kind of see the angle of this thing. It's coming at an angle like this, and I have it right up against that palate. It's right up against that palate. The closer these two angles are together, the easier your life is going to be a little bit. And it's stable. It's kind of stable in that patient's mouth a little bit. But that is the angle. So if the angle of this film is at this angle, you already have one angle down, right? One angle's already down. Okay. Then the angle of these anterior teeth, they're not straight up and down. They have a little bit of an angle to it, don't they? So these two are coming in kind of like this. That is the angle of those two angles that we have. The angle of the tooth, the angle of the film. Okay, so where is the bisector? Is it on the outside of here? Outside of here? It is between those two. There's your bisector. So we can take this, I could put it back. As accurate as I possibly can, and then that is your bisector. Are we good? Okay, so what does that mean to us? Well, we're going to take your PID, and we're not going to be at the angle of the tooth. We're not going to be at the angle of the film. We're going to be somewhere in between to where we are at the vertical angle of the bisector. So this whole technique that you're learning, you know, for bisecting is based off of this idea, you know. It's based off of this idea. Where is the bisector? That's how we find our bisector. Questions on that? Okay. Go ahead.
So say you don't feel like say you put in the nose now. The nose isn't getting in the...
It is.
It is?
Yeah.
You just gotta ignore that or just...
Yeah. So, and actually I love this question because wouldn't you agree that all of our mouths are shaped a little bit differently, you know? So for some of your patients, and it depends on how you have this patient sitting in the chair. And remember, I like that patient sitting nice and straight, that occlusal plane is parallel to the floor. This is how you're learning. So remember, if you have your patient sitting in the chair and they're kind of slouched and they're sitting like this, you know, it's going to really stress your angles out. You're going to really have a difficult time. Once you get this whole concept down, I feel like you can almost have this patient standing on their head and you'd still be able to take their x-ray because you know where the bisector is. You know how they'll get the horizontal angle. But don't make it any harder than you have to, you know, and make it easy on yourselves. But I don't care what it looks like though, you know, because it's going to look different on every single patient. As long as you know where the bisector is, you got to maintain that, you know. Some of your patients, this will be like this, because we're doing a particular technique. Other patients, it'll be like this. Other patients, it'll be like this. It really depends on the angle of their mouth. Some patients have a very shallow palate, so this will not be deep up into the palate. It'll be more flattened out. Other patients have something called tori, and they have a bony structure on the palate of their torus is actually what it is. Torus for the maxillary, and that will be kind of like this, so like a bony structure. They might have out on the bottom too. It's called tori if it's on the bottom. Some of you may even have this thing and didn't even know that you had it, and that's just how we call it. And it's just an extra amount of bone that's on there that will change the angle of this film. So, so instead of this being, you know, at this angle, that bisector is now at this angle, you know. Doesn't matter how it looks, as long as you know where the bisector is, that's how it has to be when you guys take it. So, okay. So, last week I'm gonna go back to film. I know this is digital, but without this, Digital is a little bit tougher. So we really want to refresh our memories when it comes to this. So when we take our anterior and we place it in the patient's valve, remember that we're going to use those forks and go to the patient's incisal edge. I want to make sure that that film or sensor is up against the palate. And I want to keep it at that angle. I don't want to flatten this thing out and everything. I really want to keep it at the angle of that palate. And then, normally, if this was a real patient, we would ask this patient to hold it with their hand, right? But Dexter has no hands, no arms. So I'm going to take that lower jaw and just close it just to where that lip hits the back of it. And that gives me a little bit of
We're going to use
resistance.
the rubber bands are going to be interesting. Yeah, we're going to do that tomorrow.
The posteriors?
The film, anteriors with the film.
Okay.
We'll use the rubber band and
We did all talk about this, right?
Yeah.
Okay. So we got that. It's in there. We might have to give this a little bit, not so much tension on
we're here almost till 9.
there. Okay. For any periapical film, we have to find what? For any periapical film, your biggest challenge is to find a particular imaginary line. The bisector, beautiful, the bisector. And remember that we find the bisector by doing these two things. We are splitting two angles. The angle of the film and the angle of the tooth as it goes into the patient's jaw. That is those two angles right there. You agree? Okay, and then we said that the bisector split those two in half equally. That is right there. And then we said, so I'm just going to leave those, and so that is the bisector. And then we said that the PID, the flat portion of the PID, vertically must go at the same angle. So it's not going to go like this, it's not going to go like this, it has to go vertically, just as you guys found it, okay? Now notice it's like over here off to the side, you know, however you come up with your vertical, that's all we're trying to come up with at this point, okay, just the vertical. And then we can follow up with there's always three things we have to do. Find your vertical,
Horizontal.
find your horizontal, cover the film. Okay, so, but this is kind of the main thing I want to make sure that you guys have, is like, how do I get that vertical again? That's how you get it, okay? We okay so far?
Yeah.
And then I said that, okay, if you are doing your anteriors, that you can basically look with your own bare eyes, and it's clear to see that if I was going to stand anywhere in this room with my own bare eyes to see between the interproximal spaces of those front teeth, this would be the direction I would want to do it. You know, it doesn't necessarily need, but it's this high. I can be this high and go right through there. So I'm going to point this PID horizontally in the same direction as my eyes. It's going in this direction, okay? But it's still not covering the film. It's like really low, and you know, it needs to go higher, obviously. So we got our vertical, we have our horizontal. Now let's cover the film. The bottom of this PID needs to go up and up and up and up until where the bottom of this cone, if it was to extend, would hit right here at that little line on the snapper ray. Okay, so right there, it's just pretty close. Pretty close. Right there. Y'all in agreement?
Yeah.
If I took this right now, you would have a fairly accurate tooth. A fairly accurate tooth. It wouldn't be long, it wouldn't be short. It would be pretty good when it comes to film. It's different when it comes to digital. I don't know what it is, But, and I don't even know how many different digital platforms out there are like this, but I know for sure that this one, and I know I'm going to take this off. Sorry, I know you worked hard on getting that on there, but okay. And then we're going to talk about this. Let's get this off first. So when it comes to digital, this is your new snap array. This is your new snap array. Okay, and it's got rubber like on this side. This is for the posterior side. This is for the anterior side. That's for the anterior side. And I know this is going to seem a little odd, but when you take and you place this thing on, remember that the part that says Dexis on it, the flat portion of this, remember that that is the side, this is the side that goes to the PID. It faces the PID when you guys take the x-ray. But when we take the snap array, we place the snap array up against it to where the white side is in front of it. It's not going to affect your sensor in any one way or the other, but I just want you to let you know how that goes. So it's going to look like this, okay? And then I also want you to notice this. So it's very subtle differences in there. You've got this sort of like a little curvature right here, okay? Here is a little curvature. And whenever you take your patient's anteriors, those incisal edges, it's sort of a reference point for you. But your incisal edges, if that cotton tip applicator was your anterior tooth, would come about that far from that little circular half moon thing. Okay? It's about that far. If it goes a little bit further, you're going to cut off your incisal edges. Okay? If it's too far back, you're going to cut something else off. What is that something else? The apex. Yeah, apex is going to be missing. But this is more rigid. It's stiffer. It's not as comfortable to the patient, you know, and it kind of rocks sometimes a little bit in the patient's mouth because of that curvature of the patient's palate. So when I take this one out and I place this one in, right about there. Okay, now I'm going to turn it this way just so you can all kind of look at it. Hopefully the camera will pick up on them.
Oh, yeah.
So I don't know if the camera's picking up on it, but the incisal edges are a little bit away from that little half moon looking, you know, thing. We okay? Okay. So I put it at the same angle. Now, here's the other thing. I just want to kind of go over. The other subtle difference is this. Your reference point, you no longer have this little tiny angle on there to cover your sensor. It's just not there. That little thing is not on here. So your new reference point for this snap array is the word RIN. It is the word RIN right there. So on that one, you want the PID to come halfway through that whole word right there. And that'll put you in pretty good line with covering your sensor. So I've got my vertical, I've got my horizontal. I'm just gonna go ahead and take that and bring it down just a little bit further, and it's right there at the rim. Okay. And then I'm gonna actually just take this x-ray just so you can see this. I didn't change the vertical. I just, this vertical was the same as this one, right? Y'all agree? And I'm gonna take the x-ray just as it is. So I'm gonna go ahead and then maybe I can kind of put both in the same. So I'm gonna turn that just that way. It
No,
is.
the unit is not on.
Oh, the unit's on it?
No, it is.
Okay. And then we are taking an upper, it's on digital, 70 kVp, it's on adult. Okay, let's go ahead and take that picture. And then I'm gonna just stop this. And actually, that wasn't bad. That wasn't bad. I was expecting something different. So generally, whenever you go straight to the bisector, yeah, you can all take a look at that. There we go. Is that coming full? Okay.
Huh? Pretty good. Really? That's not cool. I'm not supposed to be in the video.
The world famous.
No.
Um, okay, so typically whenever you find the bisector and you go straight to it, it typically goes elongated in digital. I don't know why that is, but it does it. We got lucky right now, but here's what I typically say. Whenever you do digital, now is this PID, is it positive or negative right now?
Negative.
I would say it's negative, right?
Going from last week, from what you remember from last week, what determines if it's positive or negative? Here, let me loosen that up a little bit. What determines if it's positive or negative? Oh, I talked about this whole thing. I talked about the beach. I went to the beach.
Don't remember that.
Is that ringing the bell? I said that if you went to the beach and then you put your toes in the sand and walked right up to the water, that was 0 degrees. And then I said if you went under the water, that was negative. And then I said if you decided to turn around and go up to Big Bear, now you're up at positive degrees. In the front of this PID, remember that you have angles already set up for you. They're on there. And I said that if you have 0 that's right here and you have numbers and this bar is on the numbers above it, we are,
Sorry.
yeah, if that line is going to numbers above that 0, we're in the positive. And I know this looks down, this coming in at an angle going down, so it kind of messes with your head a little bit, thinking, well, it's negative, but it's not. This is in the positive territory. Positive territory. So the reason why I bring that all up is just to say that especially when it comes to digital radiography, whatever you're on and you found the bisector, I would typically like to add around 5 degrees more. Just to be on the safe side and
Positive?
more positive. And so I'll reference this either more positive or less positive. I won't say give it a little bit more negative. It doesn't, we're not even in the negative territory. We're all in the positive. It's either more positive or less positive. So we are now at 40. We are at 40 degrees. So I need to go to 45 because we're in 5mm increments. Now so I'm going to go back here and I'm going to do this and take it again. Now, if I'm going more positive, how is that going to change this, do you think? what is it going to look like now? I will show more of the tooth. I will make that tooth a little bit shorter. I will show more apex, you know. So I would much rather, if you're going to make any error at all, I would much rather you make it in the era of showing a little bit more tooth, you know, if we have to do it. Because if you go the opposite way, you're going to lose that apex, and then no matter what, you got to redo that whole tooth. And remember, how many retakes can we do on a patient? 3. Yeah, you can do up to 3 retakes on a patient. But I want to minimize the mistakes that you guys have to make by doing that. So let's see what that looks like. And it shouldn't be that much different, but it's enough to give you a little bit more. So let me press repeat. We'll retake that. Okay, and I'm gonna drag this one right over here. So let's just take this one out. That was the last one that we did. So let's compare that one to this one right here. So I don't know if you can see that we have a little less room down here, and we're seeing a little bit more of this area. So it's not so bad as to where we're saying that this is very foreshortened, it's undiagnosable, you know, or something like that. We can definitely see that. We can definitely see that we can still diagnose. It doesn't look that much different than this one, but it's just subtle enough to where you don't lose your apex for some reason. Okay. Now, if I went 10 degrees, this area, the incisal ledges, would be cut off. It would look like you didn't even cover the incisal ledges of your teeth, and then this apex would be somewhere right about here, you know. So know your bisector. Know your bisector. Give 5 more degrees just to be on the safe side, and you guys should be okay when it comes to that.